Next week, former President Jimmy Carter turns 100 years old. He's been in hospice care for more than a year and a half. Today, the National Partnership for Healthcare and Hospice Innovation said hospice care is often misunderstood as a last resort.
And Dr. Payal Kohli joins us now to help us better understand hospice care. Okay, so Dr. Kohli, talk to us about hospice care, and is it normal for somebody like former President Jimmy Carter to be in hospice for about 2 years now?
Now, this is highly unusual, ladies. I mean, usually what we see is in an average, people last in hospice care about 2.5 months, but actually half of them less than 3 weeks. So really the idea of hospice care is kind of more of end-of-life care. It's unusual for someone to be there for several years.
Well, and what happens in hospice care? Because I think the image a lot of us have is essentially, someone at the end of life, maybe, in a catonic state, just like a morphine drip.
Yeah.
That's not always the case,
No,
right?
in fact, it's very different. And I want us to stop thinking about hospice care as kind of where we get care and think more about a philosophy. So, dying is a natural part of living. We're all going to go through it. And the idea here is to embrace death with dignity and to really start to shift a focus from how long you live to how well you live. So when you're getting close to the end, the focus is really on sort of making sure you're comfortable, making sure your family is well supported, making sure you have the spiritual and psychological sort of resources that you need, because so much of the medical system has always been about prolonging duration of life. And when somebody thinks about hospice, you want to really focus on making it the best time of your life because it is close to the end.
I'm glad that we're talking about this because I think of, when we had to make that decision for my grandparents, but also my brother-in-law, Eric, and Dr. Kohli was very much involved in the end of the life of my brother-in-law. When we had to make those decisions, it was really difficult to decide, when do you place your loved one in hospice? What advice would you give a family who may be going through that right now?
I mean, this is the hardest decision. You'll say that from firsthand, Sam, and that happened with my grandfather as well. And sometimes we want to keep fighting. We want to keep swinging, right? Because we think we're giving up or letting them down. But really, I think it's doing them a favor to put them in at the right time. So there are some signs and symptoms and clues. To qualify for hospice, you have to be within about 6 months of the end of your life. So you have to have some sort of an illness that's a threat to your life within about 6 months. But again, that's a bit of a guess. But signs and symptoms, if they're cognitively declining, if they're having frequent hospitalizations or falls, if they're physically declining, you notice they're spending more and more time in bed or more time sort of sitting, not interacting, not socializing, or they're having a lot of pain, or sometimes it's even when that person says, it's time. So I have a lot of patients on dialysis, for example, who've been on dialysis for years, and they finally say, I'm tired of going to dialysis. This is affecting the quality of my life, and I don't want to do this.
Is this conversations we should be having as we're healthy? Because as people come to the end of their life, maybe the cognitive is not there and they're not able to make the determination for themselves at that point.
It is conversations we should be having now in our best years of our life. And this is why I'm so glad we're talking about this, because you should go to your doctor and say, I want to start thinking about an advance directive. So every single one of us should have an advance directive, and it's comprised of two components: a living will, which is you kind of spelling out if you were incapacitated what treatments you would want, and appointing a healthcare power of attorney. Now that living will can have as much or as little detail as you want, but I would encourage you to put things like, do you want to be resuscitated? Do you want CPR? Do you want feeding tubes? Do you want mechanical ventilation, even what happens to your organs after you pass. That's important to put in there because you don't want your family members to have the stress of making those decisions for you. And I'm actually medical power of attorney for one of my friends. And when she asked me, I sat down with her and I said, okay, tell me exactly what you would want. And she's a physician herself. And so having those kind of conversations ahead of time, I think empowers your family to really help you feel your best at the end of your life and make sure that they're honoring your wishes and takes that stress away from your healthcare providers. And from
You're right, and it really alleviates all the guilt and sometimes the inner worry that a lot of the family members carry. Thank you so much, Dr. Payal Kohli, for your insight as always.